5 on your mental health today. Children with the winter blues. Some experts saying the shorter days could be affecting their mood.
Absolutely. Here to explain is Dr. Alice Connors-Kilgren, a clinical psychologist at Tufts Medical Center. You know, it's already, I'm looking out the window, it's already dark, Dr. Alice. So it's that time of year when you get up in the morning, it's dark. When you go out to home from work, it's dark. The lack of daylight can be really tough for a lot of adults. But what about the impact on kids?
Yeah, these are great questions. We're all noticing the shorter days, and kids are definitely affected by the change in season for many of the same reasons that adults are. So scientifically, less daylight impacts our circadian rhythm, which can lead to mood changes. But kind of lifestyle-wise, we also tend to be more sedentary when it's dark and cold out, which tends to have a greater impact on kids because play and being active are so vital to their development and the regulation of their nervous systems.
And every year we hear about a more serious form of depression called seasonal affective disorder. Is it only diagnosed in adults, or can children also suffer from that?
Children can also suffer from seasonal affective disorder. About 3% of children are diagnosed with the disorder, and it does tend to be more common in older children and teens than in younger children. The symptoms are the same as those for depression. So persistent low mood, irritability, lack of interest in activities they previously enjoyed, changes in sleep or appetite, but they exclusively happen in a particular season, which makes it different than major depressive disorder.
And then therefore it would be obvious to someone, like a parent who lives with that child all the time. So let's talk about solutions. Is it as simple as turning a light on, or how can parents help?
Yeah, so there's a lot that parents can do to help. And actually, much of what's helpful for kids is also helpful for adults. So some of these strategies can really have a positive impact on the whole family. So first of all, parents can really focus on establishing a routine, especially around bedtime and wake time. So it's really important to try and get kids to bed and up at the same time every day. Spending time outside and getting exposure to natural daylight, even if it's like a cloudy or gloomy day out, can also be incredibly helpful. And then engaging in regular physical activity and eating a healthful diet that's low in carbohydrates and processed foods and high in vegetables and protein. And then, finally, notice if your child is not really acting like themselves. And if you start noticing some changes in behavior, setting up an appointment with your pediatrician to make sure that there's nothing more serious going on.
Great advice.
Yeah, great advice and good reminders. Thank you so much, Dr. Connors-Kilgren. Thank you.
Take care, Dr. Ellis. Great to see you.